and consulted on the contents of this bill. We're expecting our other guests to join us as well. Our second guest is a consultant psychiatrist. Her name is Dr. Frances Aduku. She's a consultant psychiatrist at the University of Port Harcourt Teaching Hospital. And our final guest is a senior program executive at Order Paper. He's one of those who ensures that Nigerians have access to a number of these bills. One of those who ensures that people understand how the National Assembly, the local assemblies work. His name is Temidayo Taiwo Siddiq. Temidayo Taiwo Siddiq, thank you so much for joining us. Good evening.
Good evening, Sandra. Good evening, listeners and viewers.
Temidayo, let me start with you. What are some of the things that were contained in the Lunacy Act that made it problematic?
So, about the Lunacy Act, I think that the major thing that many persons looked at made that act somewhat not consistent with reality is the fact that medical practitioners and judicial officers had the authority to detain anyone with a mental illness, even against their own will, and that people with actual or, in some cases, perceived mental health illnesses, including children, minors, were placed in facilities against their will. So, we had, in some cases, you had a case where police officers could arrest individuals with mental health disorders and transport them to government-run rehabilitation facilities where they forcefully deal with them for months or even years. And that's a story that was the reality of many persons who either actually had this mental health condition or were perceived to. So that meant that something had to be done, especially when you look at it, the fact that it's not consistent with the fundamental human rights as contained in Chapter 4 of the Nigerian Constitution. So I think that for me is the major thing that needed to go. This. Of course, modern trends have also revealed that we need to place more emphasis on mental health. But when you look at the full import of everything, that part was the major issue.
Okay. What were some of the things contained in the Lunacy Act that made you, I'm not even sure the word to use here. Hawa? What were some problems you had with the Lunacy Act that made you decide to campaign for a change?
Yes. Okay, can you hear me? All right.
Yes.
So I guess the obvious part is obviously the language. I think that's the obvious one, that it's a lunacy. It is what that was defined as. It is also looking at the fact that the power was really in the magistrates, police, medical practitioners to decide what happens to people that had, mental health conditions. It is that they had, they pretty much, were not recognized, to hold their rights before the law. It is that also, it's implied that, people with mental health conditions could not hold certain offices. I mean, we still see that even in the Constitution. I remember when we wrote, when there was the call for amendments to the Constitution, and we wrote part of the language with regards to insanity, things like that, not being able to hold certain offices or testify in certain places, or, all of those things. And those are things that I believe were entrenched and also powered by the Lunacy Act as well, or at least the same thinking that underlies the Lunacy Act. So I think those were like some core things. And of course, we've talked about whether we want to call it, inhuman treatment, pretty much, I think is a right term to really cover everything up. The fact that, there was, you could detain people involuntarily, you could use very archaic practices to, treat, in quote, to treat certain conditions and things like that, and, just detain, isolation, inhuman treatment, forceful and irreversible treatment as well. things like that. So those were things that were definitely a huge part of the Lunacy Act.
I have to ask, when people hear mental health conditions, they're often thinking about someone who's walking down the streets, maybe naked, maybe with matted hair, someone who's wearing torn clothes. But that's such a very narrow way to look at mental health conditions. So when you start to also hear that things like the Lunacy Act focused on illegally detaining people or detaining people that you perceive to have a mental health condition, it also lends to the perception that it's only people who are visibly mentally ill that have a mental health condition. What do you think is responsible for such a very narrow perception of what mental health condition is? What a healthy mental health condition is, what an unhealthy mental health condition is?
So I think you actually, the answer is already embedded in your question, really. And that's the power of a legislation. It's a reflection of what is going on, but it can also be a tool to change narratives as well.
Okay.
And that's why we're always very heavy on language. Mm-hmm. What is the language? What is the framing? Mm-hmm. Because more than we think, we might just think, all that is just semantics. But the truth is that, you see those semantics, they go a long way in programming us in how we view certain things. Mm-hmm. And so, of course, like you rightly said, a lot of people will look at it and, just the very fact that you are associating, mental health conditions with, just people on the streets that have stripped and, all of those things, mm-hmm. then it gives the idea that, that's what mental health conditions are. That's what people, so we have perpetuated that sort of narrative for generations, mm-hmm. On this side of the world. Mm-hmm. And so when people think about mental health, or we're talking about rights, or people know what they want, and we're saying, they're equal participants, people are like, huh? Mm-hmm. Those people are not equal participants. Mm-hmm. How? Mm-hmm. And things like that. Mm-hmm. And we don't realize that even the fact that people got to that point before they were noticed mm-hmm. is actually a testament to the fact that their rights were stripped. Because if they had their rights to quality healthcare, to the highest standards of health, they will not have gotten to that point. If they had adequate social safety nets and social support and community-based care, they will not be on the streets doing that. And so that is why it is so important to recognize the fullness of a person, irrespective of whether the person has a mental health condition or not, but particularly in this situation where people have mental health conditions. So we have seen that narrative come, of course, in terms of legislation, but we've also seen it being perpetuated in cultural, religious, practices as well, where it feels like, you hear some narratives around casting out demons and things like that, or, you cast them away. These are people that, that you hear stories that will tell you, Jesus used to cast the demons out of certain people. And that's because there's an incomplete story around mental health. And what causes, mental health conditions, and what causes people to go across the spectrum, and things like that. And so a lot of people just take it as, this must be something that happens to these people. And so for that reason, just put them aside, isolate them, whatever it is that is done to them, it feels like, you're protecting us from them type of situation.
Why do you think the story of mental health is incomplete? Do you think people are simply not interested in learning about it, or aren't enough conversations happening about mental health? What's missing there, in your opinion?
I would say it's a little bit of everything. When I say incomplete, there's an incomplete story. It is that there are two things that I always say. There is unawareness and there is under-awareness. And that's what we see a lot here. Unawareness is the fact that people don't even have the knowledge that these things, there is something like a mental health, there's something beyond just a physical health. And when your mind is like this, or when your sleep is altered, or where you lose something on someone, when you feel this way, that is your mental health. There are people that just don't know. And then on the other hand, we have under-awareness, where people have bits and pieces of information. But then what happens is that because you have very fragmented pieces of information, putting that information together can actually translate wrongly. I like to use the example of, I bring it closer to home. I'll say, okay, Hawa has bipolar, or Hawa lives with bipolar condition. And maybe that's one piece of information. Another piece of information could be, oh, Hawa beats her mother. And, you know, we take that bit of information. People who are largely underaware would likely say, oh, Hawa has bipolar condition, so she beats her mother. And you see how two independent truths might come together to create a very false narrative around people with mental health conditions. And so that is the picture that I'm really trying to paint, is that there is a lot of information out there, but we're not particularly assimilating that information together properly. We haven't put it together. Perhaps we don't have the right model framework on how to really assimilate it. But I would say, generally speaking, across the world, because mental health and psychosocial disabilities are an evolving area, and a lot of research, a lot of angles and professionals and researchers and, you know, human rights and, you know, defenders and all of that continue to raise more awareness and look at it from not just a biomedical perspective, which is the perspective that has been predominant over most of, you know, life, that biomedical, which is really rooted, a lot of the downsides of it are really rooted in colonial practices, as opposed to actual medical practices, good practices. People actually think that, oh, that's just how it is in medicine. I'm like, actually, no, those practices were rooted in the colonial time, where if somebody didn't comply, where if you didn't look like a certain group of people, you were cast away, you were isolated, you were drugged, you were drilled, you were caught, you were done, certain things were done to you. And so that became embedded in certain systems and continued to be perpetuated in, you know, parts of the medical profession, you know. But beyond that, we need to start looking at the psychosocial, which is really the part that, you know, disability rights activists, you know, really are heavy on. It is not that we're completely eliminating the biomedical perspective. It is that we need to shift that perspective a little bit and incorporate a lot more of the psychosocial. Because a lot of times what we have seen and what research really shows is that when you deal with the social factors within the environment, the barriers, the perceptions and the perspectives, the systems and the structures, the attitudes and the beliefs, people with mental health conditions are able to live a fuller life on an equal basis with other people, as opposed to us treating, you know, people with mental health conditions as objects of charity, as people that need to be cured, as people that need to be detained, people that we should protect the rest of society from, and, you know, people that cannot make their decisions because they may make very poor decisions and things like that. So I think that's like, you know, when we look at it, it's like it's not complete. We need to bring together all of these aspects, whether we're looking at biomedical, psychosocial, even psychosocial, spiritual, and, you know, bringing together of all of the you know, the cultural, religious, and all of those things together to create a full picture. Personally, I think one of the very big factors to really bring that together are, you know, people who have lived experience of mental health issues, whose capacity can be built. I just do believe that there is an ingredient that is always missing when a person with a psychosocial disability, you know, or people with psychosocial disabilities have not been consulted or robustly included into participating meaningfully in just about anything that affects them.
Lagos, join the conversation. 0700-993-993-993. Women, call us on 01465-7190. We've got WhatsApp as well. WhatsApp is 080-959-75805. What questions do you have for our guests about the mental health law? You can ask those questions as we go along. Temidayo, I'm seeing that this act creates a department of mental health services. Temidayo, which role does this department play that previously were not assigned to anyone?
Okay, the department, according to the law, has three major objectives. One is to propose national mental health policies that we facilitate approval and implementation. Another is that it promotes mental well-being, healthcare services, to facilitate the provision of humane care, including treatment and rehabilitation, at least in a least restrictive environment. And then the final one is that it promotes a culturally appropriate, affordable, accessible, and equitably distributed mental health care. But importantly, the department has powers. One of the power they have is to collect data and facilitate the conduct of research on mental health issues in Nigeria. What people do not understand, they mystify, and that's like the bane of focus of our submission. The last thing she said, she talked about under awareness and I think lack of awareness and under awareness. So when you look at it from that prism, you can see clearly that what this department will now do in many ways is to collect data and also ensure that they conduct research. I believe that when these things are done, what happens is that it will help to improve awareness about mental health illness. Another thing, mental health illnesses. Another thing that we need to also talk about in terms of the functions and powers of the department is that they are to formulate and review guidelines related to mental health conditions. But they have to do this in consultation with relevant stakeholders. That's why when you see the composition of the department as well as the assessment committee, you would notice that it's something that is heavy on stakeholder management. But to look at functions generally, I mean, maybe Awa would be able to break it. If we are reading directly from the law, it's largely just technical language. I mentioned promoting research, data collection, analysis, sharing, and dissemination of information. But other functions would revolve around facilitate access to educational, vocational, as well as leisure opportunities within mental health care facilities. So in this case, this department would visit a mental health institution, or not just any health institution that is that has the capacity to handle people, to care for people with these illnesses.
Okay.
What they would do is to ensure that this facility is conducive enough. It has the necessary humane, if you like, equipment that would enable people who are being taken care or catered to there to be treated with the most humane considerations in mind. So, like I mentioned, we can go on and on listing the functions, but I think that what I have tried to highlight are the most important functions about the department.
Okay, all right. I'm also going to ask Hawa that same question. Which role does this department play? Was it previously assigned to anyone, Hawa? This Department of Mental Health Services that the Act creates.
I mean, it's an interesting one because She Rights Woman, my organization, obviously, She Rights Woman, we had actually liaised with the Federal Ministry of Health, 2018, during the run-up to, the creation of the bill, the first reading, second reading, the public hearing pretty much in 2020. And there was a mental health desk, I would say.
Okay.
Definitely there were challenges with it, with regards to sustainability, continuity. It was one person manning the desk. There wasn't it wasn't cohesive, so to speak.
Okay.
So I think yes, there is definitely a need for a mental health department. It's quite shocking that there hasn't been one, if indeed there hasn't been one before. I would definitely say that one of the things that came up, I remember the Minister of State for Health actually mentioned it at the public hearing, the floor of the National Assembly, that there was gross underfunding when it came to mental health. Yes, healthcare generally, but when it comes to mental health, we're barely getting, at that time, I remember people in the hall and on the Senate, had said, oh, like they had $50,000 or something funny of that sort. And people were like, no, it can't be. We all probably just heard wrong, and things like that. So there is wisdom, I guess, in creating that department. I guess my own big concern with the department is the ability to work, and not just even the department, the Federal Ministry of Health and the National Commission for Persons with Disabilities. and how to synergize across the board. Because what we're seeing is really duplicity of actions and responsibilities. Who takes who has jurisdiction over certain things?
Right.
Now, the National Commission for Persons with Disabilities, we're part of we're a member of some sort of the organization or the agency,
right?
And it has a mandate to protect and promote the rights of persons with disabilities, of which psychosocial disabilities are part of.
Okay.
You have a mechanism for reporting any sort of human rights violations. You can, they sponsor certain things that have to do with education, things like that.
Mm-hmm.
And so my concern is when these things are happening, what happens to them talking to each other as opposed to, something is happening here, something is happening there. In fact, the National Commission for Persons with Disabilities has also gone ahead to work with the Nigerian police force to create a desk for people with psychosocial disabilities, just similar to how over the years we now finally got like a gender desk at the Nigerian police force.
Mm-hmm.
Now we have like a disability desk, things like that.
Mm-hmm.
And so my concern is really with the duplicity of responsibilities and how that is going to go in terms of working together. Who do we go to? Do we go to the National Commission for Persons with Disabilities, or should we wait for this department or the Federal Ministry of Health when their responsibilities are pretty much same? Are they going to be talking to each other? Is one going to be ahead of the other? And things like that. So that's my major concern more than anything. Yes, there is a need for somebody to take responsibility for the dissemination of appropriate knowledge, human rights, based knowledge, the right language, which again, the National Commission for Persons with Disabilities has the mandate to carry out according to the Disabilities Rights Act of 2018, together with the Federal Ministry of Information. Right. So it's all of these little things here and there. And I'm really concerned because it's not the first time we're seeing bills create, commissions or departments and things like that. And then we go on to see that those departments are either underfunded or underutilized, or, we're seeing silos that have duplicates, responsibilities. And then who gets affected the most are people who are in dire need of where to go to. So that's people with mental health conditions and psychosocial disabilities. So I'm wary of it.
Okay. All right. We'll take a break. When we come back from this break, let's listen some more to our guests on today's edition of Eyes and Nays. Eyes and Nays is a show that is all about legislative chambers, our legislative chambers. On Eyes and Nays, we talk about the laws being debated at the state and national assemblies. We will also look at how these chambers are performing their oversight duties on the executive. They have just passed a new mental health act. The president signed it a couple of weeks ago that is supposed to protect or at least help Nigerians with mental health conditions. I have the executive director of She Writes Woman on the show with me. She's a mental health activist. She's one of those who campaigned for this bill to pass. And I have a senior program executive at Order Paper on the show with me, Temidayo Taiwo Siddiq. How are J for Temidayo? We're going to be right back in a few seconds. I'm Sandra Ezekwesili, Lagos. Don't go away.
Data rain with my MTN NG app. Now 1 gig data for everybody will download the app. You know me now. You can also get up to 2 gig free data when you recharge from 500 naira and above with your debit card or my MTN NG app.
Up to 2 gig data when I recharge with my debit card for my MTN NG app. This now real data Reno.
No be there end oh. You can also get 10% extra on top every airtime recharge when you recharge for my MTN NG app.
Wait, Feso, you mean say if I recharge for morning on my MTN NG app,
you get 10% extra airtime.
For evening, Uko?
10% extra airtime on top your recharge.
Wait, what do you call the app again?
My MTN NG app.
Correct. I did download now. Hey, that's true. Then give me 1 gig one time. Oh yeah, make I go recharge with my debit card. Make I follow collect 2 gig plus 10% extra recharge.
Terms and conditions apply. What are we doing today?
At ShopRite, you'll find everything you need and more. Buy Coca-Cola 330ml variant cans at 154 naira 99 kobo and Nestle 800-gram Golden Morn cereal at 1,499 naira 99 kobo. Prices valid to the 22nd of January 2023. Only at ShopRite Circle Mall, Jakonde, Lekki. Lower prices you can trust always.
Moves must be made. My people just to work hard. Dreams and challenges motivate us. But sometimes, when the journey gets tiring, all we need is something to push our limits.
Reactor, ignite your energy. Bring out your inner champion. Reactor, ignite your energy. Bring out your inner champion.
Reactor Energy Drink. What you need to push your limits.
Wahala, Reactor Energy Drink. Your limits, no get tired. No way, Reactor Energy Drink. Reactor.
Push your limits.
We all have that one friend that always hides everything from everyone else. Like my guy, Sheon, that got 1 gig free data when he downloaded my MTN NG app. Did he share the gist with us?
No!
But we found out, and even something he doesn't know, that we get up to 2 gig data if we recharge 500 naira or more on my MTN NG app with our debit card.
You don't mean it!
That's not all. We also get 10% extra on every airtime recharge made on my MTN NG app.
Wow!
Will we share the gist with him?
Yes!
That's correct. You get 1 gig free data when you download my MTN NG app. Up to 2 gig when you recharge 500 naira and above with your debit card on my MTN NG app. And 10% extra on every recharge made on the app. So what are you waiting for? Download my MTN NG app today to enjoy. Terms and conditions apply.
Guys, here he comes.
Guy, any gist today?
What are we doing today?
Wake up, sleepyhead. It's Girls' Day Out.
Fine. What's the plan for today?
Okay, so we have a 9 a.m. hair and nail appointment at the salon. At 3 p.m., we're going to watch the new superhero movie. Have drinks with Emeka and his friend at 6. At 8, we're going to try out the new restaurant at the mall. And...
All that in one day? How?
Easy, my love. Start your day with a bowl of cereal made specially with Olympic milk. Let's get going.
Enjoy the goodness of Olympic milk to own your day. Olympic milk. Stay active.
It's a new dawn for Nigeria. Oh, better days are coming. Better days that gives us hope and strength.
It's a new dawn in Nigeria. The firmament portends a bright future as the people of Nigeria move to vote a man whom they have come to trust. That man is Asiwaju Bola Tinubu. Vote Bola Tinubu as president of Nigeria. Vote Kashim Shettima as vice president. Vote APC.
Bring the smiles back to all Nigerians.
My people, it's that time once again. Have my chance here again, so my people don't go. You got to take good care of your skin. Got to check on your skin so it's not like sandpaper. Make sure you rub your hands, oh yeah. Make sure you rub your legs and your face, oh yeah. Thanks to Vaseline, everything's so smooth.
Vaseline Petroleum Jelly shields you from the harsh effects of Harmattan. Created to lock in moisture, Vaseline keeps your skin smooth, soft, and protected.
So soft, and thanks to Vaseline.
Book a ride on Anaya to move around Lagos. From Lekki to Oshodi, from anywhere to everywhere. Try Anaya and you won't go back to your old ways of moving around Lagos. Hurry and download Anaya app today and get your first ride for free using the promo code FIRSTRIDE. Anaya, ANAYER. The power to move.
Betway is giving you the chance to boost your multi-bet winnings by 700%. To activate your boost, visit betway.com.ng and create a multi-bet that has 2 or more legs. Check your boost on your bet slip and place your bet. It's that simple. The more selections you add, the bigger your boost. All winnings are credited as cash. Betway Win Boost, for the love of the game. No under 18. Responsible gaming.
Listening
listening to your number one station for talk.
Your number one station for talk.
99.3 Nigeria Info. Let's talk.
I'm Sandra Ezekwesili. How will the Mental Health Act protect Nigerians with mental health conditions? We've got on the show with us today a mental health activist and the executive director of She Writes Woman. She's one of those who campaigned for this bill to pass. She was consulted on its contents, Hawa Ojefo. And we also have a senior program executive at Order Paper on the show with us. Tamidayo Taiwo Siddiq works at Order Paper, whose job entirely is paying attention to what happens in the legislature. And on Eyes and Nays, that's what we do. We launched this segment of Hard Facts 3 weeks ago. This is the third episode. And on this segment, we talk only about laws that are being debated, laws that have passed, laws that are on the pipeline to being passed, laws that have been stepped down. Essentially, we're telling you how the National Assembly, the state assemblies work. And we also take a look at how they're performing their oversight duties on the executive. We're talking about the Mental Health Act today because it just passed. The president just signed this law. We finally replaced the Lunacy Act with a modern Mental Health Act. Hawa is cynical about it. But at least we are making a step in the right direction, Abby? Okay. You can join the conversation 0700-993-993 How do we have statistics for the number of Nigerians admitted to or into hospitals yearly over mental health? I'm asking because last week we mentioned that this act creates a single 5-person mental health assessment committee at federal level, right? So if we have that, this single national assessment committee, won't there be a serious bottleneck? So again, do we have statistics for the number of Nigerians admitted into hospitals yearly over mental health?
So I do not have those numbers, and that's if they even exist. I hope they do. I think that's very important data. Perhaps Temidayo might be able to shed some light on maybe something that has crossed his desk. What I would say that it's more of what the number would help us do. Because by looking for a number about people that have been admitted would skew the data or the decision making only in favor of who gets admitted. Now, we're also looking at how to deinstitutionalize, and we're also looking at a system where people are admitted involuntarily for other reasons that are beyond just mental health conditions and things like that. And so I would also, again, be skeptical about, if there was data particularly for that reason. I would say we want to be very careful about what we're doing with that data, because the measure of mental health conditions is not in how many people that get admitted per se.
Okay.
Because people would people would come to mental health nonprofits, other civil society organizations. People would present to, even their local clinics or primary healthcare centers with recurring malaria. Because we do know that a lot of times, because we don't address things at the psychological or mental, level, it could begin to show up in our bodies as physical health conditions and things like that. You would see people also be at, teaching hospitals and general hospitals, things like that, getting care, not as admitted, clients or anything of that sort, but, just one-off or going in and out, on a weekly basis or things like that. And so we need more comprehensive data sets for, to be able to make a decision with regards to, either the the tribunal, or whatever it is that they call it, and definitely there will be bottlenecks, and that's why for us, when we contested the bill in 2020 at the public hearing, one of the things that we were saying is that if you're going to take out involuntary detention, that is the best practice, globally. But when you now say, oh, we're not going to take out involuntary, okay, we're going to take out involuntary detention, but
we'll set up
we'll
committee.
have we'll have certain cases that will go like this, and I'm like, we're just adding another layer to, like, I don't know. I still need a lot more convincing with regards to
the necessity of that committee.
Necessity of it, really, Sandra, because it just seems to me like we're trying to find work for a tribunal, because I'm just thinking about it. I think you talked about it last week. Like, how is there going to be this central body that everybody in the country is going to come to? Come on. We already have problems with efficiency and running efficient systems. The best thing is to simplify, as opposed to try to create more and more
bottlenecks and inefficiencies. Lagos, join the conversation. 0700-993-993 01465-7190. We've got WhatsApp as well. WhatsApp is 080-959-75805. We lost Hawa's connection. We lost connection with Hawa for a bit there. Hopefully it fixes up and she can get back in on the conversation. But Temidayo, I want to come to you really quickly and get your thoughts on on the statistics for the number of Nigerians who are admitted into a hospital yearly over mental health issues. Do you have that data? Because how I was saying, maybe you would have it. Do you have that data?
Not really, but in because of course, preparing for the show from the very first episode, I did find out that according to the World Health Organization, that's the WHO, the records show that 1 in 4 Nigerians are suffering from some sort of mental illness. That's about 50 million people, if you are using the population stats of 206 million. So you would say that about 50 million Nigerians, 1 in 4 Nigerians suffer some form of mental illness.
Okay. All right. So that's a large number. It's not a number of people who have been admitted or who are getting admissions, but it's the number of people who have dealt with some form of mental health condition or the other. I think we have Hawa back now, but if we don't, Temida, let me stay with you and ask you how much power the Federal Ministry of Health has over state health ministries address mental health. How much power do they have over how the state health ministries address mental health? Because I have to ask whether or not primary health care isn't purely a local and state affair.
Okay, so we dealt a bit on this last week. I still remember. By the way, I was back, but importantly, I mentioned that one of the very key things that you would point to federal ministries over state ministries, whether health or not, is policy direction. I mean, policy direction comes from the but the issue of health on the legislative list, that's in the constitution. Health is a concurrent thing, which means that both the federal government as well as state governments can legislate on issues of health. And which is why you also see that many times when there's an issue, a pandemic, an epidemic, it's tackled from different fronts. So you had just to digress a bit, you had the presidential task force now steering committee on COVID, and then you have states also making their own effort. So to speak directly to how much powers, I think that is largely a case of influence, not really a case of powers, except maybe you are not dealing with the law, and then that one has nothing to do with the ministry. It's really about, okay, there's a law that that governs the entire federation. So whether you are at the a state general hospital or a state health facility or a primary health care facility which is run by local government, you need to adhere. If the law says don't hold people against their will, you have to obey that. And of course, we must realize that they are violations, which is why it's now a law, and which is why activists like Awa and many others are celebrating, because there has to be deterrence. You can't just hold people against their will in the name of, oh, the person is suffering a spiritual attack or whatever you call it. So right now there are violations. You could go to jail for about a year, depending on the nature of offense. You would not just go to jail. There's also the part about fines. So when you put all of this together, you will see that it's the law really that will speak, not necessarily the ministries.
How talk to me here. How much power does the Federal Ministry of Health have over the way state health ministries address mental health?
I would like to think, just like what Temidayo has said, the direction would come from there, really, because at the end of the day, they would be the ones to wield or at least disseminate and step down and have the law turn into action on the ground, or at least create the guidance for all health institutions across the board to act, whether it's the state level or even private level, because at the end of the day, it's the law of the country. I do believe that on some level, different states would need to adopt and adapt, domesticate on some level, because we know that Lagos State, for example, has a mental health law of its own, and so there needs to be some congruence or synergy across the board with what is allowed, and things like that. So I think that there is something. I'm looking forward at first to look at, I'm looking forward to the national policy that would come out of the law itself. Let's see the direction of what it is. Yes, the conversations have started a while ago, and I'm looking forward to seeing how that will come into play. Because obviously, if we're looking at community-based care, what does that look like? We already know that primary healthcare centers are underfunded. There are barely, adequate healthcare workers in many of the primary healthcare centers, not even the comprehensive ones. The comprehensive ones will typically have like a medical doctor there, from time to time, but all of the others don't necessarily have like nurses and health workers and things like that. And so how do we want to really go about it? I foresee a lot of task shifting going on in terms of the policy direction on state level, local level, with regards to making the true essence of the law come, meets those who are furthest behind or those within communities. So yeah, I do think that there's a lot of direction that the Federal Ministry of Health will definitely have to take in terms of leading this.
I'll stay with you, Hawa, and mention a part of this act, the new Mental Health Act, that I found interesting. It bans sterilization. Was it legal under the Lunacy Act, sterilization? First of all, what does it mean when it says sterilization, and was that legal under the Lunacy Act?
Yeah. It's really interesting, the kind of practices that have been in the mental health space. So many things with regards to ECT, the shock therapy.
We still have shock therapy here in Nigeria? We had it?
We have documented, at Your Rights Woman, we have documented incidences of at least 1 or 2 women in particular in northern Nigeria who were subjected to ECT. So somewhere, somehow, it still happens. And a lot of times, many of them are not aware of the consequences of what they're doing or what it is that is really being done to them. It's just a case of they said that that's what we should do and it would help our mental health. And so they carried it on. It is not supposed to be a widespread practices. Is one of those practices that's supposed to have been left behind. I'm not going to say that it is only Nigeria that does it, but we still see it, but it is largely frowned upon by the human rights community as well, locally and internationally. But yes, in addition to that, you have sterilization, which is in some cases, it is what it is, sterilization.
What is it?
So for some people, it is really, if you look at it from, oh my gosh, maybe Temidayo would help me out here. So if you look at it from a sexual reproductive health and rights, perspective, you see that it is like they would like carry out procedures to sort of like cleanse the person, you know, or whatever the person is dealing with. You know, and female reproductive or sexual and reproductive health and rights, it would be like doing things to ensure that you are not able to, you know, you are sterile pretty much.
So you're not able to reproduce.
Sandra.
No. This is strictly for education purposes, because I have a lot of listeners who are probably encountering the term sterilization for the first time. They don't know what it means. Now, there are some who do know what it means, but I need for them to understand what it is so that they can understand why it is bad, and so that they can understand why this new Mental Health Act bans it.
So, I mean, the bottom line of what sterilization is supposed to do is so that it can ensure that people with mental health conditions or certain kind of disabilities, was really something that was done with people that were different, you know, generally speaking. Again, another archaic practice. But the idea was that we don't want you to pass on your genes to other people. We don't want you to continue this thing that, you know, this
so
sort
eugenics,
of
essentially.
Pretty much. Don't pass it on. Don't go and reproduce. We're trying to curb your number within the society. So let's keep you from doing that. You know, and that's why we're very, very particular about the shift from the biomedical to the psychosocial, but more than anything, really underline human rights, you know, best practices, because there has been so much damage, Sandra, so much damage. Like till today, I am still yet to find somebody who has been admitted in a psychiatric hospital involuntarily that will say, oh, I came out better for it. I'm still yet to find somebody, you know, because the practices can be they are life-changing in the worst way possible, you know, so, yeah.
99.3, hello.
Hello, Sandra.
Thank you for calling. Welcome.
Yeah, good afternoon.
Good afternoon. What's your name, ma'am?
Yeah, this is Dr. Ikomi.
Welcome, doctor.
Yes, I've been listening to your show, and I need to correct a lot of things.
Okay.
So I hope you would allow me some few minutes.
Yes, please, go ahead. Please, go ahead.
Now, you see, the mental health bill or the law now is a very fantastic thing.
Okay.
And hello, can you hear me?
Yes, I can hear you. Go ahead.
Yeah. And your guest has been talking, and she's been talking as if most of the abuses that mentally ill patients have been subjected to have been done to them at the psychiatric hospitals.
Okay.
And this is a lie.
Okay.
You see, most of the abuses have been done by people who are not professionals, and I'm talking about maybe traditional faith homes, people that call themselves therapists that are not even licensed to practice mental health care. You know, these are the places where the abuses usually take place. If you, I work in a psychiatric hospital, and we don't abuse patients there.
Okay.
She also mentioned one thing. She talked about ECT. ECT is still a very fantastic treatment, and we still use it till tomorrow.
Okay.
Researchers have proven that ECT is very good, and it has saved a lot of lives.
Okay.
And I give you an example. For example, if somebody has severe depression, and the person is suicidal, you give ECT, the person comes out of it in no time.
Please tell me what ECT is. So, what is ECT? Tell me what ECT is. What is it?
ECT is called, it's an electroconvulsive therapy whereby you administer like a shock therapy. You know, you administer like a small dose of electricity to somebody's brain, and this is to change some of the chemicals in the brain. Now, the thing is that before we give ECT to anybody, we explain to the patient if the patient is in the best position to understand. If the patient does not have the capacity at that time to understand, we explain to the relatives, and they give us informed consent. We just don't grab patients and just apply ECT on them. No. And let me tell you, there is no treatment without side effect. Even if you go for a surgical operation, you are going to give an informed consent. And if you cannot give it, maybe you are not in that capacity, your next of kin will do that. And I tell you, even the anesthesia has side effects. So there is also, no, you see, she's been talking and portraying ECT as a bad thing. See, you see, it is a very fantastic treatment, and researchers have shown that it is very, very good, and we still do it. So, see, I know that she is a mental health enthusiast, but she's not an expert, and she should not talk as one. Then number three, my third point now.
We're out of time. Unfortunately, we're out of time. I have to take a break. Unfortunately, hopefully we have some time after the break. Stay here.
This is to inform you that if you want to record outstanding success this year, join Dr. Abiola Salami, the world-class performance strategist, and his friends at the event Rock Your 2023 Like a Champion, holding at 4 Points by Sheraton on Saturday, 21st of January 2023 by 10 a.m. Registration is required. Follow at Abiola Champ on Instagram for further details. Abiola Champ on Instagram for further details.
This is an infomercial.
Hello Lagos, something big is here again. It's empowered consumerism. This allows you to do a one-time shopping from our mall and you enjoy a percentage of our profits as other customers shop after you. If you aren't earning from the products and services you're already using, quickly find us and get rewarded. Your shopping must start paying you from today. Our locations are Ikeja, Surulere, Ipaja, Ijegun. Send OK to 080-3454-5800. That is 080-3454-5800. You can come for your shopping or we deliver your daily consumables to you so your profit will start rolling in. Hurry now while stock lasts. Call 080-3454-5800. That is 080-3454-5800.
More talk, news, and sports after this.
Now, of course, I wish we had more time to stay on this. I've got barely 30 seconds to wrap this up. However, I know you have to say, I know. What if we do this? Sometime in the middle of the week, we can have you come back in.
No way. There's gotta be something.
There's no time. There's literally no time. We have another break.
Okay, so let me
we have another break in 10 seconds. Literally, it's like 6 seconds now. Howard, but thank you for your time, Howard. Thank you, Temi Dario. Let's take this break.
PLC FMN is committed